Welcome to another version of AMI Today. I'm sitting here with my beautiful wife, Coleen, who is not only beautiful, but also our executive director at AMI.
Yeah, welcome. Glad to be here.
So we're going to talk today about some clients and some wins that our clients had,
Okay.
and things they experienced. You know, a lot of people we talk to, a lot of new people all the time, and they're wondering like, well, does AMI work, and what's it like when you're involved? And we thought we would have a show today where we let some of our clients explain to you what their experience was like. So we're going to do that.
Yeah, great.
The first thing we're going to talk about today is expanding services. One of the things that AMI, as you know, has helped people do, and it did it for us in our practice a quarter of a century ago when you were in kindergarten. Basically, it helps to expand services where you have a bigger scope of the practice when you integrate. It's not your scope gets bigger, but the practice scope gets bigger, and there's services you can do that are very, very, very beneficial to the patient. And we've had a lot of clients realize that. They bring on AMI services and they realize, you know, somebody's in a lot of pain, and instead of like putting them on Easton with a hot pack or trying to do muscle work on them for a half an hour, the nurse practitioner or the MD comes over and does an injection of lidocaine, which is very safe, and the patient gets up and goes, "What did you just do to me? I feel great."
Yeah.
And then you get paid for that. Better than you would have if you did the muscle work for half an hour. So it really does open up your practice by bringing on services that are totally congruent with not only your philosophy, but also your patient getting well. It's actually a model that helps patients get well.
Yeah, and kind of adding to that is what I always say about a beauty about these types of practices when you talk about adding on services is that a medical practice has all medical services that are available out there to be added on into a practice. So for instance, that once a medical doctor or your nurse practitioner works up a patient, you actually want these array of services behind you. I mean, that's part of it. You know, as chiropractors, the scope is limited what you can do. But now, as you said, there's a whole array, and they're never ending. So you're able to add many, many services, simply like hospitals do. Many services, so that no matter what the patient presents like, you have a service to help them.
And that is how we modeled our clinic, you know, very much after the model that is presented in hospitals. You working in a group of people working on head injury patients. Yep. You'd be working with a bunch of different licenses, a physiatrist supervising, and then a cognitive therapist, a speech therapist, OT, and a PT, which was you, and you'd work together as a team. So we modeled it the same way. And then clients, when they put this together, you know, it can be overwhelming, but when they start to realize and they go through the training and they realize what we can do, it really helps them out. And Matt Egbert is one of our clients from California, and he went through this all right about the time that COVID hit.
Wow.
So Matt had he had a double challenge there, trying to introduce new services and also going through COVID at the same time. And he did a testimonial on a video explaining what happened when he did that and how AMI helped him and actually probably even saved his practice in surviving COVID.
Wow, and he was California?
California.
Wow, California was really hit hard during COVID, right?
Yeah.
So he must have really, he had a lot to overcome, didn't he?
Yeah.
Yeah.
So let's listen to Matt and hear what he has to say about it, and we'll be back in a minute.
Okay, great.
You've been a client with us since October of 2018. Integrated your practice then. Have you seen good results since then?
Absolutely. Yeah. It is amazing to see how much it opens the style of practice that we do. You know, I love chiropractic. I love doing what I do. And I also love being able to offer additional services to people that are congruent with what I believe and offer them these additional products and find like-minded providers. Both the medical doctor and nurse practitioner we have on staff are very like-minded, and we work well together. It's been phenomenal. Thank you personally. I really appreciate you and Coleen, the team over there at AMI, because the value of what I've gotten from you through this crisis right now has been huge. And I know that I signed that deal with you for you to help me get to where I'm at already. But then you guys really stepped in and you said, we got to help people survive this. What can we give them now? And you've delivered just huge for me. And for my
thank you. You got to realize I do have a great team. There's people right now in this team helping to produce this for our webinar. So I do have a good support staff, but thank you so much for that acknowledgement. And the more we can give you, the more we will, because we want you to continue to succeed and help others. So thank you for being part of this.
So wow, that was a great testimonial.
That was fantastic.
Yeah.
That was fantastic.
So Matt had the struggle of California of all states was a little bit tougher than most.
Absolutely.
And so
yeah.
what he decided and what he learned from us was, hey, we're essential. We're a medical practice and we are essential service needed. And in taking that viewpoint, it shifted like, oh, it's so hard, I can't get people into. Where are these people who are going to hurt themselves go?
Absolutely.
Like if they hurt themselves clean, what did everybody do during COVID last year? They cleaned their garage, they cleaned their basement, they fixed their yard
Absolutely,
up,
yeah.
and they injured their backs.
Yep. Yeah.
And where do they
back,
go?
Back pain doesn't stop because of COVID.
That's right.
That's right. Yeah,
right.
yeah, absolutely,
So
yeah.
being an essential service, now we're attracting in new patients who are trying to handle that.
Yeah.
And Matt did very well with that.
Yeah,
now, one of the
absolutely.
things some people bring it to our attention about, well, now he's got more problems because now he's dealing with more people and the headaches. And I hear guys say, I don't want the headaches of having to manage more people. Well, in business, there's only two conditions, growing and shrinking.
Mm-hmm.
And when you grow, the barriers they change, they're
Yeah.
different.
Yeah.
And people is a barrier because you have to be able to be skilled at handling people.
Absolutely.
And
Yep.
managing
Yep.
a bigger staff.
Yep.
And so he did get rewarded for what he did. And our next guest, our next video we're going to play, Dr. Ken Gillman from Tennessee, also had a similar experience. He applied what he learned and he had tremendous growth his first year. And then what he did is he took that and he reapplied it into what he was going to do in the future. So we can listen to Ken and let him speak for himself about what happened to him when he joined AMI and what was his result the first year and then what did he do with it. So
Yeah,
let's take a look.
let's hear it. Yeah.
Let's take a look at Ken and we'll see that.
Okay, great.
The sky's the limit. It's unbelievable what we can accomplish through the AMI system and the team that they help you create here with the new services, the new strategies. It really has been a joyful ride.
Okay, great. And so, all right, so the goal was double the income and you did that within 11 months, you say?
Well, and actually that's 11 months from signing up. We didn't actually open the medical side of the clinic until March 10th.
Okay, so that took you about 3 months, three months to get the
Yeah,
medical actually opened up.
Setting up the clinic and the legal structure and making sure that we had the staff that we needed and to be able to actually have our first day treating patients. That was March 10th of 2020.
And if I recall, March 10th was right around when we were canceling travel and canceling life as we know it practically, right?
It was the week before the nation shut down for COVID.
Okay. So how did you deal with that?
Well, the first thing we did was to let our patients know that we were doing everything we could to make this a safe environment. Well, actually, step back from that, I checked with my staff. How comfortable are you guys coming to work and knowing what's going on and where we are? Because Tennessee had no mandatory shutdown. We were they're considered essential workers because we were in healthcare. And I had no resistance from any of my staff. They were perfectly comfortable and on board to stay open and serve our patients. So we started reaching out to our active patients, our current patients and past patients, letting them know that we were here, we were going to be here, and that we were doing everything we could to follow the CDC guidelines and make this a safe environment for them to be. We changed our schedule, so we limited the reception area backing up like it could have in the past. We started scheduling by room instead of by provider or by time. That way a patient come in and go straight to their room and not real excited about it. Made some fantastic folks, full of life, full of energy, and full of potential. One of the things they teach you, if you want to grow, if you want to have lofty goals, you need to hang out with people who are already doing it at the level you want to be doing it.
Yep.
And that's where you find it. The things that I thought I'd be satisfied with and we're so excited to reach, which is where we are today, which is fantastic, but there's so much more potential that level of satisfaction or feeling of success has been shifted down the road a little bit.
Some people just don't want to change. And if you guys have any confusion at all, this is more about the patients than anything you've ever engaged in your life. This is about being able to do the things for your patients that we used to do 20 years ago and get reimbursed for as a chiropractor. Therapeutic activities, all those codes that have systematically gone away that are well within our scope of practice. But not only can we not get reimbursed from insurance companies, we can't legally charge the patient if you're in network. And I was tired of hearing that I could do all those things and make less money and make it harder for me to provide those services for patients every year. And that's what I met Mike, and that's what got us started on the integration process. Now, at the symposium, as we're changing over, I have great goals. I'm like, great. If we can make this happen, if what Mike says is true, then man, it's got to be scalable. We got to be able to do this. And then Grant wasn't involved yet. Brandon, some webinars with him, and I started talking about the 10X 360, and I signed up. My wife and I were both on that. I didn't even think about it, and I'm like, that's what I want to learn about. I was concerned that I wasn't going to get all I could get out of the 10X 360 two-day event because I didn't put enough time into the pre-event work. But I'll tell you, I was absolutely impressed, completely blown away with, and this is something everybody will tell you at the end of this, it's the resounding verbiage from everybody. I did not know what I did not know. Right? I've had a successful career. We've done great in traditional chiropractic, but I've just described where I felt and where I was and where I believed I could and wanted to go for the patient's sake. Right? Healthcare in the U.S. is broken, folks. Has been for a long time. I don't think anybody in this room doesn't get that. Right? There's an answer. There's a better way to do it, and this is it. And the more we engage, the more people we're going to be able to impact. That's what Cardone Ventures is about. I couldn't be more pleased with my experience so far, and we're only 5 weeks in.
So here's a guy, doubled his income in the first year.
Yeah.
And with that growth, like we talked about with Dr. Matt, there can be some pain points that pop up with it. And you've done a lot of work with Ken just recently.
Yeah.
Why don't you explain what his plan is going forward? Now that he doubled his income and he has more services, what's he going to do from here?
I'm glad you asked me because I just spent the weekend down at Grant Cardone's office at 10X headquarters. There was actually a 10X 360 with Cardone Ventures, but Ken Gillman actually was down there getting what is considered his blueprint to the next level of his success. And just good news to everybody, Ken Gillman is our newest member into our strategic business unit teams at AMI, which is our elite delivery teams. So Ken, as you said, was very successful through our program. He doubled his practice, doubled his income, right? And with that, as you said, comes different problems, okay? And so I was able to spend the weekend with Ken and his wife Jenny, and we talked about what are those new problems he has. And the beauty of it is that he spent all weekend learning what the SBU teams at AMI, which actually now are made up of, instead of his one coach that he had, he now has 5 SBU managers. He has a finance SBU manager, an operations SBU manager, a human resource SBU manager, professional development SBU manager, and a marketing SBU manager. He's now ready, because he's doubled his practice and doubled his staff, he's now ready that he needs to break his business up into those pillars, because he's now going to solve and tackle those pillars, because he doesn't want to stop his progress.
Right.
So with those SBU teams, he's going to really dial in all those areas of his practice so he can literally go through the next, what Brandon Dawson calls break points, which is things that stop a practice. He's going to sail right through them, and I think his practice is going to be able to be realized at like $12 or $13 million, which is incredible.
Which is why he said in the video, the sky's the limit, right?
The sky's the limit, exactly right, in the video.
He has this viewpoint that a lot of our doctors now are adopting by going into this 10X 360 track of how do you look at yourself, and how are you as a manager, and how do you handle those 5 pillars, which are very essential: operations, finance, marketing, and people. People could be broken into HR and education or training for your people.
Yeah, well, one of the things I just love about the SBU teams is professional development. The professional development track has a leadership track for the business owner. I don't know, you're a chiropractor, I'm a physical therapist. Nobody taught us in school how to be a leader.
Right.
Like, we figured it out on the ground. But when you start building, you use the AMI program, and all of a sudden you double your practice, and you may have had 3 or 4 employees, and now you have 6 or 7 staring at you.
Right.
Your leadership skills are tested, right?
Yeah.
So over on those SBU teams, your professional development manager will work with you on your leadership skills, which Ken is like super happy to he's ready for it.
Yeah, and what we've noticed is when people go into that SBU, there's different things that resonate with them when they say, you know what, this would help me the most, and Ken's going to do great. He's a great guy. He's a natural leader.
He and his wife Jenny, they work together. The two of them are a great team.
Awesome.
Yeah.
This happens with different clients. They have these realizations and these changes, and Ken had that great realization and is moving forward with his wife Jenny. It reminds me of another client that we're going to look at, Steve Lipschutz. And Steve came on board, and I think it was right about the time of COVID as well.
Yeah, it was
and
totally during COVID.
was very concerned about his
Yeah.
practice and his ability to continue practice. He's in Maryland.
Yep.
And he explains, you worked with him a lot. Why don't you?
Yeah, I did. Yeah. Yeah. So Steve came on, and the first thing that AMI helped Steve with was to put our bracing program on. Because, during COVID, as you said earlier, back pain doesn't stop because of COVID, right? And Steve had a large practice in Maryland, and he didn't have a bracing program. And so he had a lot of patients that were mid-treatment that all of a sudden Maryland was fully shut down, was not able to actually treat. And he was really, it was upsetting to him that he couldn't help his patients. So this is what we chose to do first with him, was to put
Well, we did have some guidance, I want to point out. President Trump actually realized, you know what, people are going to still have back problems. It is the most common thing that people experience. And one of the ways to avoid surgery, avoid drugs, and keep them out of the hospital is back braces.
Very
so
true.
he cut down the process of Medicare to be listed as a provider for these services.
That is true.
Cut
Yeah,
it
that
from
is
2
true.
years to 2 months, basically.
Yeah. But that he did. You're correct about that. But initially, what he did was he has a large practice. He had a large base that overnight had to stop coming in, that were still mid-treatment. So the first thing he did was handle the patients he was already working with, and he was able to actually reach out and deliver an enormous amount of bracing to these patients, and through Zoom, educate them over Zoom how to fit them with the brace and wear the brace to give them some relief before they could come back in. But yes, like you said, he realized that he has a lot of other patients that would come in for maintenance care that on and off had back pain. He was able to access those patients and give them some solution at home because, again, as you said, they're cleaning their garages, doing other things, and yes, they were having a problem. So he was able to connect with them. And that third level, like you said, President Trump was able to dial back a lot of the regulations. He was able to actually market directly to the public and actually help any of the public who were having back pain with bracing.
So let's hear what Dr. Lipschutz says about his experience with AMI.
How long did it take you to successfully implement the program?
We were up and running in just a few days from the time that we called AMI and spoke with the DME coach to get the training and get going was about 3 days total.
Wow, that's awesome. It definitely helped that you are a very quick learner. So what percentage of your patient base would you say did qualify for the program?
People are still qualifying for the program. While we were closed, we were probably able to contact at least 20% of our patients that qualified and had terrific coverage for it, and they were all in. They loved it. Our patients, for the most part, have been complaining about working from home. They've been complaining about their makeshift workstations from their bed, from their sofa, from their stools at their kitchen counter, and to a person, everybody's been complaining about lower back pain, their posture, and then pain, going all the way up to their upper back and neck. So the lumbosacral orthoses have been great for helping people with their posture and give them the support, especially that they're not getting while they're working from home.
Now that I can relate to. Did you find the coaching on the DME program useful in implementing the program?
Yeah, the coaching was terrific. I had no idea that we were able to prescribe and utilize braces like this in our practice. So it was extremely enlightening for me, and they held our hand every step of the way from the coaching from AMI to the training that we got from Azon Medical. It was just terrific.
Okay, so the bottom line, did you receive all the help that you needed from AMI to integrate the DME program?
Absolutely. Literally from start to finish. Any question that we had, any question that a patient had, any materials that we needed, billing procedures, protocols for using the DME, it was all there. Anything and everything that we needed, it was right at our fingertips. And the coaches were available instantaneously. When we had a question, I was hearing back just minutes later and had my answer in hand.
Okay, so would you say that this program met your expectations, and why?
The program actually exceeded my expectations. You know, we were looking for a way to survive while we were closed, and not only were we able to survive, we were actually able to thrive. You know, while we were closed, so it far exceeded my expectations, and quite frankly, because of that, I became a full AMI customer. This was kind of the lead into the full AMI program for me, which we joined right away.
What a great video from Dr. Lipschutz.
Totally, it was a fabulous video.
So, you know, one of the things that come up that people say, well, what happens after, when we join you, what happens after the first 2 years? So we have programs beyond that, as you know.
Yeah.
And I had the fortune of running into a client who was they were really good clients, Eric and Jessa Schaid. They came on board, and Eric was there because we were following Brandon Dawson on his tour, and we were promoting the idea of the advanced program that AMI has on really putting in your business model and your business strengths.
The strategic business units, right?
Strategic business units.
Yeah, yep.
So Eric showed up, and I was surprised to see him in Las Vegas. And I said to him, so Eric, what are you doing in Las Vegas? And he said, well, I live here. And I said, I thought you lived in Chicago. And he goes, well, we did. What about your practice? Well, we still have it.
Wow.
And he told me, we started up the program with AMI. We had all the systems in place in probably 6 months. In the first year, he quadrupled his income, or they quadrupled their income.
Wow.
And they decided that they had it running so well, they were going to move to Las Vegas because they liked living in the desert better than Chicago. And they still ran their practice. And they're doing like $3.8 million a year.
Nice,
So,
really great. Yeah,
so what
wow.
happened was, I got asking him, so what brings you here? And he's like, you know, they're young, they're healthy, there's only so much golf they can do. And so he wanted to do the next game. So he wanted to come back and apply the second part of AMI that he didn't do it. He was a great guy, he was in the mastermind, but he wants to do this program now.
So did he join the 10x360?
He did, he joined the 10x360.
Beautiful.
So
yeah.
Let's take a look at Dr. Eric Schaid and let you hear what he had to say about AMI, and we'll come back after that.
I've always felt that when patients came back year after year and they were getting sicker and sicker still, we were keeping them out of pain while their quality of life or their health was still declining. So putting everything together with the physical therapy, the injections, we do some nutrition. It's just treating the patient as a whole rather than only treating the pain. I found AMI, I believe I read about it once, filled out a thing, and then they kept calling me and calling me. I knew it was something I wanted to do. I just wanted to make sure my practice was ready for it. So 2 years after opening our office, we got a hold of Quentin from AMI, and he helped sign us up, and the rest is history. When we first integrated, I knew that it was something that we wanted to do quickly. So we had things set up, we had some decent systems, but they told us that the original contract was 2 years, so I thought the process was going to take 2 years. I decided to cut that in half. We wanted to do it all in 1 year. So we integrated in November of 17. Is when we signed up with AMI. I hired a chiropractor and associate in December of 17, and within a year we were fully integrated. Prior to signing up with AMI, we were doing right around 50,000, 55,000 a month in collections. Now we do about 300,000 a month in collections. So we'll do about 3.5 million this year. I will only be in the office probably 10 days out of the whole year. I do weekly calls with my staff just to check in with them on a personal level, just to maintain the relationships. Otherwise, my wife and I travel and golf and just have fun, enjoy life. For anybody that is considering joining AMI and is hesitant pulling the trigger, obviously I'm available all the time. If you need to speak with somebody that's gone through the program, I'm happy to talk to you. But making that commitment is the first step. It is a lot of work, but if you want to make 5 times as much money and have 10 times the freedom, it's the only way to go. Yeah, the reason that we decided to do the 10x360 and then further onto the platform is because of the level of trust that I have with the Carberrys and AMI. They've always done right by us. I believe in their model, and I believe in the future of the program. So integration was just the first step for us. We have one practice now. As I said, we phased out of it. We're looking to expand, and the goal is by 2024 to do $1 million a month in collections.
So there we go. There's another testimonial. Great
testimonial.
Great Dr. Eric Schaid and his wife Jessa, and did phenomenal with the program. So if you're watching this and you are an AMI client, you're probably wondering, well, okay, so when do I get onto that 10x360 journey to the SBU team, or how do I do that?
Yeah.
Or if you're not an AMI client and you're saying, well, I have a very big practice and I have systems in and I'm integrated, how do I do this? I don't want to go through all that preliminary stuff. Can I get in an advanced program to get into that journey? Because where I'm having trouble is with those 5 pillars of business. and there's a way for everybody to do that. So
Yeah, absolutely.
why
Yeah.
don't you explain how they can do that?
Yeah, something I say about AMI now is that, AMI did start 7 years ago, and we started as a company that integrated practices. That's what we started, right? But we've really, really grown now. And we actually now can work with a practice of any size. Kind of what I say, Mike, is I kind of explain it like, imagine yourself from first grade to your doctorate, right? And the AMI program, maybe the basic AMI program for somebody who maybe has one staff member, maybe making $35,000 a month in their practice, right? We're going to start them off in the beginner levels and really get them all the way through high school to get them through graduation. But we get somebody who comes in who's got a pretty strong practice and already doing well. We might clean up what I say a little bit of their high school, but get them right on into college. Okay, college to me is like our 10x 360 track onto what you would consider your doctorate, which would be the SBU teams, because it's really in that doctorate program, I say, on those SBU teams that you're just going to literally blow your practice up to the potential that it can be.
I mean, literally, we have clients now that are doing $12 million a year, $8
Absolutely.
million a year, $10 million a year.
$12 million a year that are targeted for $20 million a year
When
in
they
their single
multiply.
location. So I know every doctor can be different. And this is where the beauty of AMI comes in, is that we find the right place for you to land, and you grow as far as you want. Some people don't want to go to college. Some people don't want their doctorate, right? Anywhere along the line, you'll get what you want, but then you can also continue. If you want to dominate your local and regional marketplaces, we can get you on that 10x 360 track, all the way into those SBU teams, and I can guarantee you will dominate your local and regional marketplaces.
And the thing I like about that is we have a model of healthcare that works, that doesn't skip the gradients and jump
Yeah.
right into opioids and surgery. We're doing the things that should be done prior to that, which means we're doing a lot less opioids and a lot less surgery. This model works, it is needed, it is logical, and we've
Yeah.
perfected the systems. So
Yeah.
getting that in and putting that in will change healthcare.
Yeah.
And to do that, we have to go all the way up to the point where we have every region of the country dominated with this model as the first choice. And we have a way to do that.
Yeah, and do understand that we partnered with Brandon Dawson and Grant Cardone for a reason. And there is the concept of drafting, which I know Brandon Dawson talks a lot about, right? Anybody in any business can spend their time every day figuring out every granular detail on what you're supposed to do through trial and error. But if you actually look at any of the really smart business people, they find someone who's done it bigger and better in the same space. And then you ask permission to what's considered draft behind them, which is they give you all their best practices. You don't need to trial and error. So when we partnered with Brandon and Grant about 15 months ago, we've spent the last year merging our systems with the Cardone Venture systems, which was Brandon's model coming out of Audigy. He already did it bigger and better in this SBU space. So we have deployed. We now have 29 of our AMI clients, okay, in with those SBU teams. And as you said, they're already starting to dominate their marketplace. So
Yeah.
anybody out there that either wants to just convert their practice to integration or wants to dominate their local and regional marketplace, we've gone to actually partner with Grant and Brandon, so we bring to you proven systems. That's really what we're all about.
Systems that help you handle the pain points that are preventing you from going to the next level.
Absolutely, yeah.
And that's what it's all about, getting
Yeah.
to those levels that most of us never even dreamed of. $30 million, $20 million,
Yeah.
$40 million. So if that's where you want to go, we have the program for you.
Absolutely.
So what do they do, scan the Q code?
Yeah, oh yeah, sorry about that. Look at the bottom, there is a phone number and there is a email address. Just call that number or email there that you want to find out, what is AMI doing today? How can AMI help me today with what I want to do?
So you've been listening to Dr. Mike Carberry and Coleen Carberry, and thanks for being part of this episode of AMI Today, and we'll see you next time.
Thanks.